What if one careless moment in a cluttered laboratory, something as ordinary as forgetting to clean up a Petri dish, could end up saving more human lives than any war hero or medical genius in history? Imagine a world where a simple scratch from a rose thorn, a sore throat, or a battlefield wound could sentence you to a slow, agonizing death with no real defense. Then picture a fuzzy blue-green mold quietly doing what no doctor could. That is not science fiction. That is the true story of penicillin. Welcome to Story Behind the Theory, the channel where we uncover the fascinating stories behind the theories, discoveries, experiments, and ideas that changed our world. Today, we dive into the accident that launched the antibiotic revolution and quite literally reshaped human survival. To understand just how miraculous this discovery was, we need to step back into the world before it existed. It is the late 1920s. The scars of World War I are still fresh. Millions had died not just from bullets and bombs, but from infections that doctors could barely fight. In hospitals, people with blood poisoning from minor cuts, pneumonia, childbirth complications, or simple skin infections often faced the same grim outcome: suffering followed by death. Antiseptics helped on the surface, but once bacteria invaded the bloodstream, medicine had few answers. Surgeons operated with a quiet dread, knowing infection could undo their work overnight. Families lost loved ones to what we now treat with a pill 96-DCA2. Scientists around the world were hunting for something, anything, that could turn the tide against bacterial invaders. Among them was a quiet, observant Scottish bacteriologist named Alexander Fleming. Born in 1881 on a farm in Ayrshire, Scotland, Fleming had seen enough hardship to value practical solutions. He served in the Royal Army Medical Corps during World War I, where he witnessed firsthand the horror of infected wounds. After the war, he worked at St. Mary's Hospital in London, studying Staphylococci, the bacteria responsible for boils, abscesses, and deadly systemic infections. He was meticulous in some ways, famously messy in others. His laboratory was known for its controlled chaos: plates, cultures, and notes scattered about seed 1692. In the summer of 1928, Fleming left for a well-earned holiday with his family. Before departing, he had been growing colonies of Staphylococcus aureus on Petri dishes. When he returned on September 3rd, he began sorting through the stacks of dishes left on his bench. Most were routine, but one caught his eye: 11F42D. There, in a dish that had accidentally been left open and contaminated, a blob of blue-green mold had taken hold. Around this mold, the bacterial colonies that should have been thriving were dissolving into nothing. A clear zone of inhibition surrounded the intruder, as if the mold were secreting some invisible weapon that killed the bacteria nearby. Fleming later recalled the moment with characteristic understatement, but those who knew him say his excitement was immediate. He had seen something no one else had truly recognized. He carefully isolated the mold and identified it as a species of Penicillium, likely Penicillium notatum. He began growing it in broth and testing the mold juice, as he playfully called the filtered liquid. It proved remarkably effective against a range of gram-positive bacteria, including those causing strep throat, scarlet fever, pneumonia, and gonorrhea. Even diluted hundreds of times, it still worked. And crucially, unlike many harsh antiseptics of the era, it seemed non-toxic to human cells and animals in his early tests. Cf. 5D67. Fleming published his findings in 1929 in the British Journal of Experimental Pathology. He named the active substance penicillin. He presented it to colleagues, but the reception was lukewarm. The substance was unstable and difficult to produce in useful quantities. Fleming himself used it occasionally as a topical treatment or to selectively grow certain bacteria in the lab, but he never managed to turn it into a systemic drug. For years, it remained a scientific curiosity rather than a revolution. Some historians note that Fleming may have felt frustrated, but he continued his work with quiet persistence. 09282C. The story could have ended there, another promising lead lost to the challenges of the time. But a decade later, in the shadow of another world war, two brilliant scientists at Oxford University picked up where Fleming left off. Howard Walter Florey, an Australian pathologist, and Ernst Boris Chain, a German-Jewish biochemist who had fled Nazi persecution, were part of a team at the Sir William Dunn School of Pathology. They were systematically investigating natural antibacterial substances. When they came across Fleming's 1929 paper, something clicked. Chain, in particular, was fascinated by the biochemistry. In 1939, as Europe plunged into war, they decided to pursue penicillin with urgency 393802. The challenges were immense. Penicillin was frustratingly unstable. It took heroic effort just to produce tiny amounts. The team worked around the clock growing mold in bedpans and improvised vessels, extracting and purifying the drug through painstaking chemical processes. By 1940, they had enough to test on mice. The results were dramatic. Mice infected with deadly streptococci survived when treated with penicillin, while the untreated controls died. Human trials followed. In February 1941, a young Oxford policeman named Albert Alexander became the first patient. He had developed a severe infection after scratching his face on a rose thorn. His condition was dire: abscesses, osteomyelitis, and blood poisoning. The team administered their precious penicillin. Within days, he began to recover astonishingly. But supplies ran out before the treatment was complete, and he ultimately relapsed and died. The tragedy underscored both the drug's power and the desperate need for more 982E85. With Britain stretched thin by war, Florey and his colleagues turned to America. In 1941, they crossed the Atlantic and collaborated with U.S. pharmaceutical companies and government labs, notably in Peoria, Illinois. Their scientists perfected deep tank fermentation using corn steep liquor as a nutrient. A laboratory assistant named Mary Hunt found a superior strain of mold on a moldy cantaloupe from a local market, Penicillium chrysogenum, which dramatically boosted yields. Further mutations using X-rays pushed production even higher. By D-Day in 1944, enough penicillin was available to treat Allied soldiers. Infections that would have killed in previous wars were now manageable. Soldiers called it a miracle drug. Doctors watched in awe as wounds healed cleanly, pneumonia cases turned around, and lives were saved on a scale never before imagined. Estimates suggest penicillin and subsequent antibiotics saved well over 100 million lives in the decades that followed, with some figures reaching 200 million or more when including broader impacts. The 1945 Nobel Prize in Physiology or Medicine was shared by Fleming, Florey, and Chain, a rare acknowledgement of the chain of discovery from observation to application. Fleming received much of the public credit, which sometimes rankled his collaborators, but all three recognized the collaborative nature of the breakthrough. Historians generally agree on the timeline and contributions, though debates continue about exactly how much Fleming anticipated the drug's full potential versus the Oxford team's decisive push. The birth of penicillin as a practical medicine was revolutionary. It proved that nature held powerful weapons against bacteria and opened the door to the entire field of antibiotics. For the first time, doctors could reliably cure bacterial infections rather than merely manage symptoms. Childbirth became far safer. Surgery expanded dramatically. Diseases that had terrorized humanity for centuries, syphilis, diphtheria, gangrene, lost their death grip. It changed how we think about medicine, from supportive care to targeted molecular intervention. Yet the story also carries a cautionary note. Even Fleming warned in his Nobel lecture about the risk of resistance if the drug were misused. Today, antibiotic resistance is a growing global crisis, a reminder that our victories over microbes are never final. Here are some lesser-known facts that add even more color to this remarkable tale. First, Fleming's original mold strain was actually quite a poor producer. The real hero of mass production was that golden mold from a Peoria fruit market, discovered by an observant lab worker who was simply bringing in interesting specimens 1C965. Second, during the war, the Allies kept penicillin production methods secret from the Axis powers. Some accounts suggest limited German access came too late and in insufficient quantities to change their medical outcomes significantly. Third, penicillin's discovery built on earlier, often overlooked work. In 1897, a French medical student named Ernst Duchesne had observed similar antagonistic effects between mold and bacteria, but his research was largely ignored. Fourth, Fleming was not just lucky. His prior discovery of lysozyme, an antibacterial enzyme in tears and other fluids, had sharpened his eye for natural defenses. And fifth, the sheer scale of early production efforts was astonishing. At one point, the entire world's supply of penicillin for clinical use could fit into a few small vials. Factories eventually churned out enough to fill freight trains. As we sit here in the 21st century surrounded by modern medicine's wonders, it is humbling to remember that so much of it traces back to one overlooked Petri dish in a London lab. Penicillin did not just treat infections, it gave humanity a new lease on life, extending lifespans, enabling complex surgeries, and reshaping public health. It reminds us that the greatest breakthroughs often come not from grand plans, but from curiosity meeting serendipity, followed by relentless human effort. The accident that saved millions teaches us to keep our eyes open to the unexpected, to value persistence, and to steward our scientific gifts wisely. Because in the ongoing battle between humans and microbes, the story is far from over. If you enjoyed this journey into the story behind this discovery, don't forget to subscribe to Story Behind the Theory for more fascinating stories from science, psychology, history, and human discovery. And now we'd love to hear from you. Which theory, discovery, experiment, or mystery should we explore next? Share your suggestions in the comments below. Thanks for watching, and we'll see you in the next story.